Our group's disorder is Fragile X syndrome, which is also known as Martin-Bell syndrome. Fragile X syndrome is also referred to as FXS and is a genetic disorder that results in a variety of developmental delays, social issues, and learning disabilities. Physical features of this disorder affect most males and half of females diagnosed with FXS. They often include a longer face, larger ears, a prominent jaw, and a few other characteristics that may change as these individuals age. Some developmental implications for children with FXS include delays in sitting up, walking, and talking. Behavioral characteristics include trouble sensory processing, which includes things like the way they are perceived by the individual in relation to their senses, trouble learning language, poor eye contact, and risk for aggression or sleep disorders.
FXX affects between 1 in 4,000 to 1 in 7,000 males and 1 in 6,000 to 1 in 11,000 females. The total number of Americans with FXX is somewhere between 38,000 and 87,000. FXS is caused by a change in the gene Fragile X messenger ribonucleic protein 1. It is caused by an excess amount of CGG nucleotide repeats in the FMR1 gene of the X chromosome. The FMR1 gene encodes the Fragile X protein, which is responsible for maintaining synaptic plasticity and neuron generation. Testing for Fragile X syndrome includes DNA testing, which is extremely accurate and readily available. FXX can be diagnosed from a blood sample, which determines what forms the FMR1 gene. A doctor or genetic counselor can order an FXS test. If the test comes back positive for someone, it is important to test the biological family members as well. Nearly all healthcare professionals work with individuals with FXS, but a few specific ones include speech-language pathologists, physical therapists, audiologists, and occupational therapists.
Females typically have milder overall symptoms in comparison to males. Males are more likely to be diagnosed with an intellectual disability. Seizures occur in about 15% of males and 5% of females. There is currently no cure for FXS. The forms of therapy used to help treat some of the symptoms include educational, behavioral, physical, and physical therapy. At a younger age, while the brain is still developing, is the best time for intervention. There are early intervention services available to children from birth to age 3. There are no medications specifically for the treatment of FXS, but there are many meds that help with the associated symptoms. Medical issues that are more likely to occur include cross-eyed, ear infections, seizures, and gastrointestinal problems.